one more episode of ASAP Conversations. As you know, we have been curating a lot of conversations with many of our members and partners across the region in order to build a sense of solidarity and also to look at the universality of the challenges that are being faced by all of us in these difficult times. Specifically, some vulnerable groups and marginalized populations for whom the situation has become even worse. One of the ideas of having these conversations was also the fact that many voices from our region are either underrepresented or even completely missing and unheard of during global political conversations. And we thought that through these conversations, we could help bring those voices, testimonies, and case stories to a different audience. We are very delighted to have with us here today some of our partners from Thailand, very long-standing veteran, as well as some of the younger generation activists on safe abortion rights in the country. And I would now like to request all of them to introduce themselves and the work they are doing briefly. Would you like to start, Tik?
Yes, starting from me. My name is Tussnai Kantayaporn, and then let's call me Tik by nickname. I'm working for the Choice Group, and I'm the team leader of the Safe Abortion Task Force.
Thank you. Chompu?
Hi, Chompu here. Actually, my real name is Supecha, but you can also call me Chompu. I am from Tamang Group, and we have been working on this since like 2011.
Thank you. Sureeporn?
My name is Sureeporn Hawanchamnankit. I work for Women on Web Thailand and also a member of the Choice Group. Yeah.
Thank you so much. Welcome to this conversation. Before we go ahead, if you could just tell us a little bit what the Choices Group does, Tik, just so that people have a background of your experience.
Yes, the Choice Group is a group, the network forming by we have a member from government organizations and the non-government organization, and also from those who work who dealing working in the university. We have 80 members and member organization, and then we are working for 4 areas, not just only with safe abortion. We are working on prevention. Prevention is include the safe abortion and birth control, and the counseling. Counseling means option counseling, whether the choice of women will be continuing pregnancy or termination of pregnancy, and safe abortion. And the last thing is those who cannot perform safe abortion due to the late of the pregnancy, or they decide for continuing pregnancy. They have to be taken care of also. So we have a task force for these 4 areas of working. Yes. Today, I'm in charge of the safe abortion aspect.
Okay, that's great to know. Thank you so much. And Chompu, could you tell us a little bit more about Tamang? What is it that you have been working on?
Tamang is a very small group, and we have been working on counseling and referring women to the safe abortion services. Recently, we started working more on organizing women who had abortion, and also working with public to change the attitude, to mobilize the better attitude towards abortion, and also do some part of advocacy work.
Okay, very challenging work, I'm sure. Thank you for sharing. Sureeporn, could you tell us a little bit more about your work with Women on Web?
Okay, so I'm help desk for Women on Web, and Women on Web is like a platform. Like we provide medical abortion information and also the services around the world. Yeah.
Okay. So as you can see, a lot of experience and expertise gathered here today. So I would direct my first question to Chompu. Could you tell us a little bit about the abortion law in Thailand and, you know, the recent Supreme Court judgment which kind of challenged it, and what is the backdrop of the legal situation in terms of safe abortion?
Yeah, thank you for having us today, Suchitra. For the background on abortion in Thailand, we have the criminal law, which is from 1957, and that prohibits women from doing abortion. It means the woman who perform abortion, who do abortion to herself or to receive abortion, she's illegal. That's the first article. and then the law continue to prohibit anybody who would provide abortion. Doesn't matter if it is safe or not safe, it is prohibited. And then, but then it has another article which say, oh, but if you are a doctor and if woman is on some condition like just with the physical condition or she's raped, then you can perform abortion. Since 2005, if anybody who would like to perform abortion and can have the evidence that woman has the mental problem, it doesn't mean that she's crazy or something. She feels bad.
Unwanted pregnancy.
Yeah, yeah. But still, the doctor and the lawyer feel like this is not usable and it is not very clear. So many doctors feel like this is still obstacle for them to use to provide abortion and to use this law. So Choice Network and Tamang and many of us go to the Constitution Court and asking the judge to decide whether the criminal code, especially section 301, which states that woman is a criminal when she does abortion, and we ask whether this is against the law. This is what we ask. This is against the criminal or against the constitution law. We ask whether the criminal code 301 against the constitution court. That is a question one. The second is 305. Is it against the law? Is it against the constitution law? And finally, after 2 years, in 2019, the constitution court decide that yes, the 301 is against because it's against the women's rights. I'm very happy with the word that they say. Is women have the autonomy over our body, so it's her right to do abortion. So 301 is against the constitution court, but we also need to balance with the fetus right or children's right, and so it means the 301 should be changed for sure. It is against the constitution law, but we have to balance, and it needs to be adjusted to be adjusted, not just eradicated, but it is contradict for sure. And 305 is not contradict to the constitution law, but because this law has been here for too long time, it needs to be changed to the situation right now.
Well, that's good to know, and congratulations that your Supreme Court has been so forward-thinking in its judgment. So what is the process now that the Supreme Court has said it's unconstitutional? I suppose you still need to go back to your policymakers for them to actually change the law, right?
Yeah, actually, it's the after that the cabinet have the meeting and assign to 3 ministries: the Ministry of Health, Ministry of Human Development, and also Ministry of Justice. Okay. That they have to work together to adjust this law. And now the คณะกรรมการกฤษฎีกาเรียกว่าอะไรนะพี่
The unit in the Ministry of Justice that they have to define the law in order to submit to the cabinet. I don't know the exactly word for that.
Like a cabinet.
Yeah, not really a cabinet, but it's an office that work out in order to outline the law, or even develop or change the law.
That's great. I mean, I'm sure that will also take its own time, but the fact that Supreme Court has given such a clear judgment and statement is definitely, I think, of great use to the advocates. So moving on from that question, I would like to ask you, Tik, in terms of the current law, what does access look like to safe abortion in the public sector or in the private sector? From your experience.
Okay, thank you very much for your question. Continuing with what Shimpu had been said recently, after the Constitution Court decided for that, we make a campaign in order to say that now abortion is not a criminal matter. It is a health care. Yes, we are trying to push this into the public in order to repositioning abortion. Yeah, whatever is still in the in the criminal law. But for the abortion in Thailand, we can say that we are very backward. I mean, comparing to the surrounding country like in Vietnam, because we just recently registered the medical abortion in the 2014. You are really late, right? And the drug is imported from your country. Yeah, and but after the registration, I mean, the process is very quick because in 2016, 2 years after the registration, the abortion drug is become an essential drug list, national essential drug list, and at the same year, the abortion service has put into the health service package. Health service package means in Thailand, everybody can access to health service for free of charge if they are the Thai citizen. Yes, with this, if you are a Thai citizen and you want abortion service, you can go into the public hospital and get the service for free, and maybe free of charge, but maybe you pay a little, like for the ultrasound or for something else, but it will be very little. And the hospital will get a compensation from the National Health Security Office for like 24 US dollar. Yes.
That's
yeah.
wonderful.
So the process is like that. It seems like it's very perfect and good, but unfortunately, we have only a few hospitals who join this program. Yeah, like currently we only have the health service delivery for safe abortion cover less than 50% of the all province in Thailand. Yes, and if we count in terms of number, we have only 71 clinic and hospital provide this service. Yes.
Sorry, what gestation age is abortion allowed? Sorry to interrupt. Till what gestational age is abortion provided in public sector?
71 is covered private and government, and for private we have like 25 clinic and 2 hospital. It's a private hospital, private and NGO mixed together. But I mean, under the NGOs or private hospital, they receive the women, provide the service for women with the demand of the women, like mean on request of the women, whether it is a socio-economic problem. And then if it is the socio-economic problems, like Chompu said recently, that they will have a depression test for you. And of course, every woman who has the problem, they have a depression. So normally they use this and they make the depression test. And if the test is pass the criteria, they are eligible to receive the service. And this is what is work now. But in the government hospital, unfortunately, they can charge from the National Health Security Office, but only a few of them provide the service on request of the women. I mean, even some hospital, the law allow them to do, but they just not want to do it.
Okay. And what about private sector? How much does it cost the women to get an abortion in the private sector?
It varies. If it is less than 12 weeks, it can be ranged between 78 to like 300 US dollar. So it's very valid. Yeah, it's valid. Yeah, so it depends on the clinic as well.
And
Yeah.
in the public sector, is it available to all kinds of persons who may need the abortion? Like, say, if it's an unmarried person or a young girl, or does it? Is it for
There
married?
may be a criteria for like the criteria is depend on hospital. If we're talking about private and the NGOs one, I mean they are most likely to provide for all. But if we're talking about the government, they have a certain criteria. Some criteria is maybe like we call it like the criteria that the health staff is preferable, regardless law or regardless anything else. They want to do, they do it. And if they don't want to do it, they just simply don't do it. Yes.
So that
And that's
to
the issue.
that takes me to my next question, which is for Chompu. Is what is the socio-cultural environment within which, as Tik said, no matter what the law says, people just do based on their beliefs or what they are comfortable with. So what is really the environment within which these either the stigma or the practices are being seen?
Yeah, I think it is not only about the law why abortion is difficult to be accessed to in this country. It's, I think, more basic than that. The base is about the attitude of Thai society, and its attitude towards women. Yeah, even if Thai women have education, actually, by statistic, we have slightly higher education than men in the university. Yeah, but women are still expected to be a good mother, to be a good daughter, to be a good woman in general. Yeah, and reproductive health, reproductive and household stuff is still supposed to be a women duty. Yeah, so when we are talking about contraceptive, it is women's duty. Condom is a contraceptive, but it is man, so it is not very wide practice in Thailand. Yeah, even if we know about it, we learn about it, the government give it out to somebody for free, but people don't use it. Yeah. So when doing abortion, it is, if women are pregnant, it is women's responsibility. If she needs to do abortion, it is even her responsibility to like find a place or pay for. When she is a mother, it is her responsibility to take care of herself and also her baby. Yeah. So all the reproductive health is women's duty. So when we think about this, we find that then when women do abortion, yeah, so we become a bad mother. Yeah? We are supposed to be a good mother, yeah, but we are a bad mother because good mother do not kill the baby. Yeah, so we are seen as a mother that we don't do what we are expected to do. Yeah, to have a baby, to have as baby as your family wants. You want to say, I don't want another fourth baby. I don't want my first baby. Whenever I want it, I will have it. That is not the way the woman have to say in Thai society. We supposed to be a good mother. We supposed to, as a mother, you don't kill the baby. So we are seen as a mother, and because we are Buddhist, we are seen as a killer, and the killer of the baby. And so when we do this, it seems like when women do abortion, it is like there's no man sin. Yeah, we open. I open the blog. I mean, we have the blog for the for some time. There are many women writing about their own story. To my partner, my ex-partner, to my ex-boyfriend, or that man who get pregnant with me, who get me pregnant, who have sex with me, and then I do abortion. No about that. Everybody asks, what will happen to me? I kill a person, and then the baby, the ghost baby will follow me. I cannot do anything good in this my life. You know, it is like Buddhists also put the sin on a woman, only. Yeah.
So I think
So,
the situation you're describing, Champu, is not only in Thailand. I think it's across the region. You know, because the patriarchal controls that it's not just about the abortion. You know, the patriarchy wants to control women's sexuality. So if you have sex when you are not allowed to have sex, you need to be punished by this unwanted pregnancy. So you can't make it very easy for her to have an abortion,
yes,
because then, you know, she can have sex whenever she wants. And including, you know, as you said, this whole religious issue that gets brought into the picture. It's not as though countries which are Buddhist, like say Thailand or any other country, you also have an army, right? You have your soldiers. But somehow that's okay. But when a woman wants to terminate a pregnancy, suddenly the whole religious perspective is brought in on her. So it's always very, you know, double standards. And it's the same everywhere. I think it's the same in India. It's the same in most of the countries in our region, where the whole aim is to make the woman feel guilty because you're not a good mother. Whereas she's actually trying to be a good mother by maybe not wanting to have so many children so she can look after the ones she has. But that conversation is never allowed to happen.
No. You have to have baby, and it is your nature to take care of your baby the best. Yeah. So that's the way. Yes, and women have abortion because she has sex. Yeah, and women shouldn't have too many sex. So when women do abortion many times, it's even worse. Many people are talking about it now. Repetitive abortion. Oh, I will do. I think P yeah,คุณติ๊ก and it seems like now even the healthcare provider who's providing the abortion, they feel like we have to like force women to use the long-term contraceptive and put it as the condition for women to have abortion. And I think that comes from the attitude.
Yeah, you're absolutely right. And in fact, that takes me to my next question for Champu. In terms of, you know, as Totik actually, as Champu said, there is a whole lot of socio-cultural, religious background to the stigma that women face when they try to seek an abortion. But what is the attitude of healthcare providers in Thailand? Are they supportive? Are they willing to interpret the law to the fullest extent? And how does this tie up with medical education? Do you have any insights on that?
Yeah, well, first thing we have to understand that healthcare provider is living in the same context as others in the society. So the way they're thinking of is the same thing. Yeah, anyway, but the number of the hospital that provide the termination of pregnancy is indicate that they are not feel have a negative. They have a negative attitude towards the abortion. Yes. Some provider acknowledge the choice of the women if the women want abortion, but they have a negative in terms of they think abortion is sin. Even they think in a different way, but they care about their social environment, like they have family, they have workers, they have co-workers, they have any other, they have friends. So they are trying to make themselves not different from others. Otherwise, they cannot, for example, they cannot say in the public that, wow, I'm working in the hospital and then I provide counseling for abortion or I provide abortion service. They have to disclose that because they know that the society is not recognized.
So there's stigma on the healthcare providers also if they are providing abortion. So they can't openly say they support.
I think both stigma from outside and some also stigma themselves.
Right.
I'm talking about the majority, but we have only a few healthcare providers who recognize this, acknowledge this as a choice of the women, and knowing that what they are providing or what they are doing is meaningful for the life of the women. So they continuing doing that. But this is a minority of the healthcare provider.
I would like to ask Sureeporn that now with this whole COVID-19 situation, and I think Bangkok also, Thailand was also in lockdown till recently. How did that affect access to safe abortion for people who you generally are in touch with, through your work on women on WIT?
Okay, so we already know that most women have been encountering the problem of accessing to abortion, right? Not only the country where abortion law is restricted, but also those countries where abortion is legalized, because some women cannot access to service, maybe because they cannot afford or they cannot travel to the clinic, right? So the problem that women are facing right now, like before, is even multiple due to COVID and the lockdowns in many cities, because women cannot, of course, they cannot travel to maybe like other areas that they would get access to abortion, or they have to stay at home because they have to take care of the kids, right? Or even they can travel to the service provider, maybe they get rejected to provide a service from hospital because the capacity limitation of the health service provider. So yeah, so I think in the first stage of COVID-19, we got a lot of requests, but for Thailand, Women on Web had to stop providing service for a couple of weeks because of the in terms of the supplies and logistics problem. So we just recently solved the problem for short term.
I just would like to add, Kate, that the access is not because of the lockdown of the area, but it also the hospital stopped providing the service.
Right.
Yeah. In particular, those who travel from any other province or any other area.
Right.
And that's why. And then we found that during the crisis, almost 50% of the hospital or the clinic stopped provide the service.
Right.
Yeah. And that's the crisis.
Is that because they didn't have enough personal protection equipment to use, or is it because the hospitals were full, as she said, with other patients?
I think they take the precaution that if you provide the service for those in your area, and in general health service is safe, but if somebody from outside, it's considered unsafe.
Okay.
But unsafe for the COVID.
Okay.
And that's why they I mean, it's very easy that if they want to abortion service is the service that many health staff don't want to have it.
Right.
So they can use COVID as a reason to stop this service, especially those who against the abortion service.
Yeah, I was about to mention about this too, because for Women on Web, actually we can provide service, but until certain gestation, right? So when it's over our limitation, we will always refer them to local service and local hotline. And one obstacle that we've seen is that even the hotline, like local hotline, they have to shut down the hotline and use like other platform instead, like Facebook chat. And some women cannot access to maybe some women don't have Facebook, something like that. Yeah, and when they go to a hospital or they talk to the hotline, it's turned out that sometimes they also contact to the local service and they reject.
Right.
Yeah.
Well, yeah, that's what I was going to ask you. So, given this environment where access is becoming so difficult, and we don't see the situation changing very much in at least a few months, or maybe even the rest of the year, what has been the approach towards using telemedicine as a good, using this opportunity to promote telemedicine for abortion access?
Yeah, at the beginning, telemedicine is not proposed solution. Is a way of treatment that proposed nationwide for the some kind of like diabetes, right? Mawan, and the other chronic disease. Yeah, and then we use this China as a way to introduce the safe abortion service. And before, I mean, now we are on the process to, I don't know, meeting and fighting and elaborating with the Ministry of Public Health and the Medical Council and also the Nursing Council in order to set the standard of doing the telemedicine. But at the same time, there are some medical doctors who already provide this kind of service.
Right. Yeah. No, I think that's great because other countries like the United Kingdom and New Zealand have also used this opportunity to try and push for regularization of telemedicine. We are also hoping in India to be able to, as you said, start with the meeting and the fighting and the discussions with all the key stakeholders. So it's been really amazing listening to the conversations. And as I said, one is, of course, the solidarity that all of us have. We all stand together, no matter whether our countries are different, but also to understand the universality of the experience. Very similar to what we are hearing from many of the other countries in terms of whether it's the socio-cultural patriarchal environment, whether it's the health providers' attitudes, whether, it's the COVID-19 has brought up all the, magnified all the gaps in systems. And I think your generation has had this tremendous advantage of, social media and online platforms that Tik and I can tell you, we never expected that, you can literally reach out.
I come from the generation which is far from gate. You can be my daughters.
But you remember the telephones we had where we used to dial like this, right?
Exactly.
What is all this about? So it's really been wonderful talking to all of you and solidarity with all the work you're doing, of course. And we do hope that at some point when the restrictions are opened up and we are able to meet sometime in person. But till then, thank you very much. Stay safe and take care. And we will be in touch soon.